All right, let's talk about this. A lot of people have been talking about the concerns with monkeypox. It's spreading in parts of around the globe, we're seeing.
I guess now they call it mpox. Health officials raising the alarm after a patient tested positive for a more dangerous strain of the virus in Sweden.
It comes as the World Health Organization called mpox a global health emergency as it spreads rapidly in parts of Africa. Joining us now to talk more about it is New York City Health Commissioner Dr. Ashwin Vasan. Doctor, thank you so much for being here with us this morning. The first question I have, the first thing that popped in my mind, what is this strain? What makes it so different? What makes it so dangerous?
Yeah, it's a great question. It's great to be here and great to be talking about this at this time, because this is before it's a risk to New Yorkers. We're getting out ahead of this and talking about this. Look, what WHO has seen in the Democratic Republic of Congo and in surrounding countries is that there's a new strain of this mpox virus that is moving a little bit more quickly, that at times has been associated with a higher, more severe disease, and it's popping up in surrounding countries that haven't previously had cases of mpox. And now, of course, we've seen the first case in Western Europe, in Sweden, which is very similar to the pattern we saw in 2022. So for all of those reasons, WHO is also getting out ahead of it and saying, now's the time to prepare. The good news for New Yorkers is that we are prepared, and we are in a much different position than we were in 2022 when this was entirely new to the U.S., but there's still steps we need to take now.
So, Dr. Vasan, how is this similar and how is this different from that strain in 2022 in terms of what we need to know? I remember talking to you then, and the strain was spread largely in sort of gay communities. Is that still the case now? How is it spread? What do we need to know?
Right. So mpox, monkeypox virus, is a family member in this orthopox virus family, which is related to smallpox. The way that it shows up is in these small lesions, pimple-like lesions that can be in the genital region or other parts of the skin. And then the way that it's spread is through skin-to-skin contact and prolonged skin-to-skin contact. So that means sexual activity tends to be the highest risk behavior. And so the people at greatest risk of getting and passing monkeypox on, mpox on, are people with higher risk sexual behaviors, multiple sexual partners, attending sexual parties and other gatherings. And so, yes, we believe that were this version of monkeypox to arrive in the U.S., that the risk group, the population at risk, would still mainly be men who have sex with men. But what we are seeing in this outbreak in the Congo is a little bit of spread within household contacts as well. So we are mindful of that too. The ways to keep yourself safe, of course, starts with changing behavioral patterns around sexual contact, around skin-to-skin contact, and knowing what your risk is. Number two, it's vaccination. We launched the nation's biggest vaccination program in 2022. And so a lot of people are vaccinated. And if you have received 2 doses, which is the recommended protocol of the vaccine, then we think you have long-term protection and you do not need to get a booster of any kind. But there are many people who did not get vaccinated in 2022, and there are many people who only got 1 dose in 2022. And those are the folks we encourage right away. Go talk to your provider, visit vaccinefinder.nyc.gov and get vaccinated today.
So what do you say to New Yorkers? How do New Yorkers prepare now? I know this is happening in the Congo. We're seeing the spread. You have the case in Sweden. But New Yorkers, how should they prepare?
Well, look, we are all connected, as we've learned with COVID, with mpox in 2022. So what's happening over there will arrive on our doorstep sooner than later. And so knowledge is power. Knowledge is the antidote to fear and anxiety and paralysis. And so visit our website, nyc.gov/monkeypox, to get all the information about what it is, how it's spread, and what you can do to protect yourself. Visit your provider and talk about getting vaccinated. You can also visit any one of our sexual health clinics around the city to get a free vaccination. And really know your risk. This is about behavior change plus taking the steps like vaccination to keep yourself safe. We're ready for this, but we just need to know, we need to be empowered to take those steps together.
Commissioner, thank you. It's all about taking preventative measures, and that's why we thought it was important to have this conversation.
Yeah,
thank you so much for joining us.